welcome to the Illuminating Immunity Virtual Summit, Light Photobiomodulation versus COVID-19. My guest today is Intranasal Kokos. He's the Director of Yolong Trade in the Slovak Republic. Since 2007, he has been running, managing, and developing the company that works on health and beauty products, in particular medical devices that help for brain modulation and blood irradiation or photobiomodulation of the blood through the nasal pathways. Thank you so much, Frank, for being here. You've been talking about the COVID and photobiomodulation for quite some time now. How long have you been investigating light therapy and viruses?
Light therapy and viruses. It is not so long, but because I was looking for solution on how the laser blood irradiation works in a human body all the time from 2008, and I was developing and studying, buying literature, studying. In first 3 years, I bought everything from the world what was possible to buy, especially Russia sources. And we have seen that possibility of laser blood irradiation is so huge that, for example, in one book from Russia, there were 130 diseases you can influence by that method.
130 diseases that you can influence. I'm just saying it in English in case somebody has trouble with your Slovak English. So that's different diseases that can be influenced. So of course you've been looking at a lot with general health with this intranasal application. We talked at the Brain Summit about how it can affect the brain and the blood. And now you've started to investigate how it works with the virus. Tell me about that. What's your insight into that?
Could I go to my presentation or shall I speak?
Let's go. Oh, we can go.
Okay.
So we are going to examine in this presentation how COVID-19 worsens the blood viscosity, the rheology, the red blood cell membrane properties, and how we can affect this with our blood photobiomodulation or blood irradiation. What did you say that they used to call that, Frank? You told me that they used to call it blood what? What did they call it in the old days?
Laser blood irradiation.
And then they called it blood?
Laser blood illumination.
Illumination.
Illumination. Then low-level laser therapy, blood photobiomodulation. But each time you get effects, improvement of blood circulation and microcirculation. But the main reason is improvement of blood viscosity and rheology.
And could this be when, a part of the effect that happens when you put the light on any part of the body, because it's going to be affecting the light? Light is going to affect the blood on any part of the body. It's just more directed and more powerful directly in the nose, correct?
The nose is very good place because it has no melanin, no skin, plenty of capillaries. Blood is flowing very slowly. So it is perfect ideal place. If you put anywhere on the other part of the body, blood flow there is much lower, and also skin is changing light properties. But I don't tell you cannot influence the blood, but not so well like in the nose. There is immediate effect in the nose.
Excellent. So let's go. I'm excited. Everybody wants to hear this. Let's go. How COVID worsens the blood. Go.
How? Okay. This part is not important if we get it or not. But if we are healthy and we get it, we will manage it more easily. In comparison with the state, we are not in good health conditions. So if you check people, when you are young, there are no problem to fight with diseases because young people have usually perfect blood, viscose with low blood viscosity, with good rheology, and it is also the key for strong immune systems. Condition in your body is the key for fighting with invading microorganisms. And I, from my experience, consider three conditions as the most important: blood viscosity and rheology, pH value, and ORP, oxidative reduction potential, or redox potential. If you control all the three conditions, and if you improve one of them, you improve also the second and the third. Any of them is improving the others. So the three conditions are important for your longevity, for your healthy life, and also for your happy brain, because every cell in your body can be happy in good conditions. Okay. When you are older, the older we are, during the time, many times we are dehydrated, for example. We go through many diseases, and each of this case and situation is leaving footprints on our health state. So many times worsen physical properties of the blood, lower oh God. I have to stop here because I didn't manage that situation. Sorry, you can. Okay. When we are older, you see, COVID-19 is more dangerous for older people, or obese people, or people with some diagnosis, because the conditions are not as good as in young people. So bad blood viscosity and rheology brings low perfusion, follows ischemia, acidosis, oxidative stress, and immune response is altered. So that what is happening in the body is that homeostasis is out-regulated. I will continue in next part to explain that, what's happening. If we get pneumonia, having coronavirus, we get nearly immediately low oxygen saturation of hemoglobin. This means ischemia. Ischemia means we don't have enough oxygen for our combustion or metabolism. Then is continuing acidosis because blood flow is not correct, is lower. So CO2 is growing and oxygen is low, we know that. Always when there is acidosis in tissue, there is always connected oxidative stress. It is joined, it is connected. The more acid you are, the higher oxidative stress you have. Then there comes the risk of blood clots formations or thrombosis, or heart attack, or similar situation, or thrombus formations in lungs. It's common by COVID-19. And to the end, there is also accumulation of the waste in the tissue. There is developing inflammation of endothelium, and from all that processes is situation in the body worse and worse and worse. I will explain it again. Leopold D. Intranasal, superior author of one article I was looking for a very long time. To the end, previous year I found it, and he's explaining very clearly which is role of high blood viscosity in the development of ischemia, infarction, and thrombosis. Basic causes can affect blood viscosity is increasing plasma viscosity. Bad blood viscosity is increasing plasma viscosity, then is increasing red blood cells aggregation, internal viscosity of red blood cells, hemoconcentration and concentration of white blood cells, and immediate effects and vicious circles are indicated. So this diagram is very, very superior. Basic cause. Here are some explanations what's happening in the body. How can we make our blood viscosity bad? Bad and worse and worse. So for example, here are infections and here are viruses, toxins, for example, bacteria. So we have COVID-19. COVID-19 is causing pneumonia. Pneumonia is causing that the oxygen is passing through alveolus walls and endothelium into blood more complicated. So that's one reason of bad oxygenation. And also because it is inflammation proteins in blood are growing. And that inflammation proteins are sticky. So we have all that process from the left to the right side. We are on the bridge. That virus is causing blood high viscosity syndrome. So there is excessive aggregation of red blood cells, excessive concentration of red blood cells, and excessive internal viscosity of the red cells. This is happening. The same is happening with white cells. And with, there is developing high plasma viscosity. When we have that, we come to immediate effects and we get localized stasis, localized hypoxia, platelet aggregation, capillary occlusion, and so on, localized acidosis. But here on that side, if we are worsening situation of blood viscosity and rheology, here is positive feedback loop to the beginning. And that positive feedback is worsening situation again. You come again on that side and positive feedback is worsening and worsening and you are in vicious circle. So that situation is happening exactly with, in connection with COVID-19. So positive feedback is aggregation of red blood cells, stasis, hypoxia, aggregation of platelet, turbulence, microembolism, and so on. And also hypoxia, anoxia, acidosis, necrosis of tissues, increased rigidity of vessel walls, and so on. So then we can continue. And at the end, we are on the right side, where we end with infarction, thrombosis, arterial thrombosis or coronary thrombosis, hypertension. It's long-term process, but exactly that mechanism is included in nearly each hypertension case. Yeah. Then ischemia, thrombosis, venous thrombosis, gangrene, ulcers. Yep. And yes, please.
Well, what I'm saying is that I see this, and I'm just saying that they have shown that you have to break this cycle up somehow in order to recover. And one of the things that they're using is nitric oxide. You know, you've heard about that. And that is a great way to increase the oxygenation and the vessel wall rigidity. It's a way, the things that they're telling us are working exactly on this phenomenon of increased blood flow. You know, the vasodilation, in nitric oxide supplementation is one way. And this is one of the ways that the light therapy and the photobiomodulation can influence this. This is what I'm saying.
Yes, blue light is good for exactly for that, because it makes vasodilatation, but red light makes good blood viscosity and rheology.
Correct.
And if we want to go out from all that, and I will show you in our case studies, we have made 2 cases. It's possible, and possible is we have to cut that circle.
That's correct.
And we need to create in that people good blood viscosity and rheology. If we make that, oxygen perfusion into blood will be improved. We will see. So I continue. So that is one of the best in the world.
Very good slide. Very good slide. Thank you.
And this is the second one from the same author. And he is showing here, for example, here is virus, and here is infection or thrombosis. Mm-hmm. And so all that cycles are running here, and everything is connected. And one bad matter is influencing the second one, and that is influencing, and we go here and so on, and here, and we are in circles. So how to cut it? We need to cut that situation. I will show later how. So I don't want to go into details. Everybody can study this and think about that, because all that is really running in the body. Here's a simple picture. It's from my microscope. I am using different cameras. From one camera, perfect blood, clean serum, 1, 2, 3 white blood cells, all red blood cells, discocytes, beautiful. everything separated, elastic, only seldom deformed chain, for example, here.
Very good. And these have the oxygen in. These are oxygenated, right? Because they're bright white. Huh?
Yes, oxygenated because white middle. If they are dark, they are not oxygenated.
Very good.
So not oxygenated, but it's dark. Here is second picture. So imagine one situation and how you will feel in that situation. So here you see how red blood cells are sticky. Why they are sticky? Because plasma proteins make them sticky, they make them rigid. If that happens, they are connecting. Firstly, they are lemon-shaped and such strings like roller, sorry, oh God. So it's a problem if there are surface layers that bind properly oxygen.
So what? Say that again. Say that again. The surface layer to bind. Say that again.
To absorb correctly oxygen. That surface layers are everywhere in the body. They are in plasma. Plasma is in contact with all the cells. How can the cells breathe well? It is influencing everything. And plasma proteins are doing really a lot. So there is also heart needs more work. You need more higher cardiac work to press such strings through capillaries, because you have to separate each such erythrocytes. They are passing one after the second. They are rigid. There is a friction with endothelium. There is inflammation of endothelium. So in such conditions, it's very difficult to have good blood oxygenation. And exactly such blood, I suppose, I didn't make analysis, but I suppose such situation in people with COVID-19. So next, we made study with our device. We decided to help some people, and we made 2 case studies, and both were using our as their treatment, and also our devices bioconjugate or NS devices. In one case there was a laser, in second case was LED device. And here you can see what's happening. So patient 1, description, 89 years, standard without medications, male, right-handed, without overweight, did not undergo any serious illness or operations, with optimal immunity and full vaccination, healthy lifestyle, non-smoker. Here are his temperatures, mean, max, average. For example, we started day 1, 39.7, went up, slightly lower, but day 6, 36.8, and average is here. So it is average, for example. It is just showing he had high fever. High fever is always helping. It is only one factor which is helping to keep good blood viscosity and rheology, but not enough. Not enough because that conditions in the body are horrible. But this is important. First day, pressure, systolic, diastolic, pulse rate. So 155, 92, 87. Systolic, diastolic, pulse rate. After application, 134, 82, 76. You see decrease. And oxygen before application, 85, after 93.
Wow. And this was how long of an application?
It's in my article. I will give you the article. I think it was one application and 12 minutes. First 4 days he was using 10 hertz, and last 2 days he was using 40 hertz.
Good.
I think 2 or 3 applications a day, but we measured only one application.
Very good.
So day 2, you see there is improvement in blood pressure. There is improvement also before, after we very high, not so low like here, a little bit higher, but okay. Oxygen higher before than first day, and higher also after. and so on and so on, and we come here, day 6. Before application 132, but here first day was 155. After 78, before was 92. Pulse rate 87, here was 68. And what can compare this value and this value?
Correct.
So first application after 6 day applications, 120, 72, 65. What does it mean? We improved blood viscosity and rheology. We improved blood circulation, but we improved also SpO2 on fingertip, which means we improved perfectly also blood absorption, oxygen absorption in lungs. If blood flow and oxygen is better there, it is better everywhere. So from 85 we went to 98, and these 2 days after application was 98. So case study 1 is ready. It's showing what is doing our device.
Very good, very good. I just want to go back. I want to ask one question, and I won't,
Yeah.
and I'll refer to the paper myself.
Mm-hmm.
But let's just say that this person had a natural recovery. Let's just say he got better by himself. Most of the times it takes 10 to 14 days to recover. And just the bottom line is this person recovered in 5 or 6 days and was feeling better quicker. Temperature went down, like you said, everything sort of got better quicker. So that's something also to point out. Not only that these are all good things to have, good blood SpO2 and good blood pressure, but this is also connected with the person feeling better and coming back in a very short period of time. But thank you.
If you improve red blood cells membranes, also all the cells in the body, you improve effectivity of the use of medicaments. Everything is transported better, absorbed better, everything is working better. And body is using, immunity is working better. All the systems are working better. So that's why it's happening. People will feel much better very well. Just they need to improve blood viscosity, rheology, because if we take care just for to increase oxygen in their lungs, it's not enough if blood is not able to take it.
That's right.
So we need to take care for both sides of lungs. One side is air. It can be enriched with oxygen, but more important is blood. If we take care for blood, blood will take it. Blood will push away CO2, and blood will take more oxygen. So you have seen the 2 pictures,
yes,
good blood, bad blood. So there is a difference. Case study 2. Patient younger, 77, but thicker, greater waist circumference, I don't know if it is correct, 100 centimeters. He had arthritis urica, so increased uric acid, which means he lives acidic lifestyle, vaccinated against influenza, unhealthy lifestyle, smoker, 15 cigarettes a day, mild hypertension, medicated with some medicaments. And here are his temperatures. Day 1, average here. Day 2, higher. Day 3, lower. Day 7, he went down, 37.7. So temperatures were showing, so he went also over 40, yes, the max temperatures. But also here is important this. We started before the same pressure, systolic, diastolic, and pulse rate, 161, 98, 92. And he was doing values every day, 3 times, and here is 7 day. So from these values, he finished on the 7th day, minus 20 systolic, minus 18 diastolic, and minus 12 pulse rate. SpO2, he was starting with 84 First application we went to 85, second day 86, 85, 85, 89. But what is important is here 84, 85, and here 90, 94. He was not in good state. He was thicker, acidosis, so everything is showing he needed longer treatment time. Treatment time depends also on the situation in the body. But here you can see on that case again, improvements of blood rheology and viscosity are helping a lot and supporting any treatment and everything good what are doing doctors. So it's second case. Yesterday or about 2 days before, I got an article from BBC News, Richard Galpin. A third of hospital patients develop dangerous blood clots. You can read it here, that article, and it's true. And here are some citations from that really that people have blood clots, get infarctions, have thrombosis, and have thrombosis formed in lungs. So I will not read that because I am not a good English speaker, so you can read it probably.
Pulmonary embolisms in blood clots in their lungs. He believes that the number of critically ill coronavirus patients developing blood clots could be significantly higher than the published data in Europe of up to 30%. So they're already publishing, but it could be higher than that. So I don't know if 30% is the low or the high, but still, they're dying of lung inflammation, lungs.
Yes. Also here are some information, but it is just
in severely affected patients we are seeing an outpouring of chemicals in the blood, and this has knock-on effect of activity of blood clotting, ultimately causes the patient to deteriorate. So having sticky blood is having wider repercussions than just blood clots. This also leads to higher rates of stroke and heart attack. Sticky blood is contributing to high mortality rates. Samples from places showing corona in its blood, making it much more sticky. And sticky blood can lead to blood clots and everything that we talked about. This change in the blood is the result of severe inflammation in the lungs and the body's natural response to the virus. Wow. Good call, Doc. Good call, Frank.
Okay. I believe it's true. I think that people don't die directly on corona, so many, but for following complications, blood viscosity, rheology, and with that connected problems. It's my opinion, but I am not really expert in that. I am expert in what I am doing, blood viscosity, rheology. Before I was very active in combustion processes and their optimization, so I understand very much about what are proper conditions in the technological processes and also in the body. If you shift ratio, fuel and oxygen, so you can create really bad conditions and you can create really high acidosis. It's like if you have industrial furnace and you lower oxygen into under stoichiometric ratio, so you get a bad combustion. You can get CO instead of CO2. You can get carbon, for example. You get a lot of waste, and you need to increase the fuel. You are increasing fuel consumption, and you are worsening economy of everything. So it's very important to run correctly and properly in the body, that processes. If you do that, we improve a lot. So what we are recommending for healthy people, because we have sold more than 4,000 devices, our customers shall use device nowadays to keep blood viscosity and rheology. It's good to stay warm, eat antivirus products, and stay alkaline. Because COVID is always connected with acidosis, and acidosis is very, very bad, and it is worsening blood viscosity and rheology again. It's clear. If you are acid, you cannot have normal blood flow, and it is that positive feedback loop. And we shall also decrease oxidative stress. So it's simple. So it's last page. I don't know.
Eat vitamin C. The things like that to keep
I will, yes, it's there. I want to tell you just, here is article. Protocols and all details. I will give you article. I made article about how COVID-19 worsens blood viscosity and what happens in the body. There are all connections. Everything is connected also with that simple presentation, but it's a little bit more difficult. And there you will get also details about the protocols, how it was used. You have devices in USA. You can also make tests on some people. It's simple. You have seen, no problem, and you can test it, and you will see that it is working really so. So all that people.
So what do you say about the, thank you for that. Thank you for the presentation, and thank you for the article that you'll send over. I'll make it available to the viewers. But what you're saying is that you can improve your health in your blood, which is going to be pushing the system to be healthier overall. We didn't look at an immune response here. We didn't see it kill the virus. We saw that it, assists the body to have better blood, which is going to increase your circulation and anti-inflammatory, all those things that we talked about. So it's a very big topic that you brought out, and I'm sure that this is going to be a very positive input, and I think people are going to like it.
Originally, Joe, I was thinking about photodynamic inactivation of viruses. I was studying a lot of some supplements, their absorption characteristics, also which wavelengths of the light to choose, considering blood properties and so on. But in reality, I came to conclusion this is available immediately, what I am telling in this presentation. People, if they improve, will help, will shorten their time of healing. They can use medicaments from their doctors, and it is working. Antiviral products are working and they are effective. So they just need to increase effectivity, and they will get out from the disease very quickly and in short time.
And think about this, Frank, even if if we have a product that would kill the virus on contact, you still have to remove all the debris, and it still has to clear the lungs, and it still has to clear the body. So, having the blood to be able to have the viscosity to pump to move that stuff out and not get more thick, right? The dead particles is going to make everything thicker anyway. It's got to go out some way.
I will tell my consideration. I have article, it's photodynamic activation of viruses. I was considering to use blue light because absorption of blood is not too high. Intranasally, it's very, very, very good. It's accordingly some sources even able to kill circulating viruses. But the viruses are binding the human cells and their receptors. And it is a problem, they are not circulating anymore. But if you kill some in the blood, so it's good because it is form of how to tell that, photobiomodulation. If you destroy them and remove them, your immune system is being taught to recognize their antigens. So it's
there you go.
Good. So there exists a way. We are going towards blue light. There is product, let's say artemisinin, we have it in our portfolio, which is killing viruses of malaria, which is killing cancer cells, and we have very good experience. And that product is able to kill also viruses and bacteria. And also absorption is perfect for blue light. So if you take artemisinin like antiviral products combined with blue light, you can do really a lot. And it is acting in cells. Because only blue light and to kill circulating viruses, it's one part, but I don't suppose very much successful. Much more successful it will be with good products, which are able to react with viruses, because viruses and bacteria don't have antioxidative systems, and our cells have. And artemisinin is doing nothing else than oxidative stress in the cells. And so is killing, reacting with iron and releasing free radicals, and the virus cannot survive. So our goal is that, but because protocol is not proven, but our devices are registered, like I was showing today, there is no problem with applications. But protocol for such application, like I told now, it needs a lot of time and testing and so on.
Well, I want to thank you for, I want to thank you for the, I want to thank you for your time. How do I forget I can do this?
My English was not so bad.
You're getting better every week. This is like a course. I love it.
Okay.
Thank you.
The goal was to give you information and to all the people.
Thank you for your contribution.
Too many dying, and I am so sorry. So
that's fine.
Okay. Bye-bye.
That's what I want. Hold on now.
Okay.
Wait a minute. Fuck, I can't. Stop. Hold on. I'm trying to stop recording. Stop.